Okay, greetings and welcome to this masterclass with Dr. Abigail Siever. What every woman and her partner should know about perimenopause and menopause. I'm really excited about this talk because there are so many questions about this time of life and so many people struggling with various symptoms and hormones changing and not really knowing what to do. Um, so this is for women and their partners to really learn about it. My name is Vasi. I'm the founder of the Thrive community. I support people with stress eating and letting go of excess weight. And yeah, the Thrive community is also home of the Thriving Gut series that Dr. Abigail led a few months ago, which is an awesome course um, that you're welcome to check out. And I'll turn the floor over to you, Dr. Abigail.
Okay, thank you. So, welcome everyone. Some of you know me. I'm Abigail Siever. I'm a naturopathic doctor. And so, if you are starting to notice hormonal changes in your body, or maybe you're already in the thick of it with menopause, or you're a partner who wants to be supportive, you are in the right place. So, as a naturopathic doctor, I look at things through more of a whole person lens. So, rather than just looking at you as your hormone test results, I want to know about your sleep. I want to know about your gut health. I like to know what you're doing for exercise and your diet. So, I really like to incorporate all of those aspects of your health, your diet, your lifestyle into coming up with a plan for balancing your hormones. And that's going to be incorporated into this talk as well. So, one of the biggest takeaways that I want you to have or come away with after we finish is that these symptoms are real. What you're experiencing is real. They're very common, and there is quite a lot that we can do to help. So do not despair. There's a lot we can do. So let's talk about what is happening in the body. So why these symptoms are showing up, what exactly physiologically is going on, and then what we can do to support you. So let's start by defining perimenopause and menopause. So there's a lot of confusion about this. What exactly is going on? When does it start? When does it end? So perimenopause is the transition period before menopause. Typically starts in your 40s, and it may last a couple of years or it may last a decade. And it's when hormone levels are changing, but they haven't yet completely gone down to very low levels. And then menopause is defined as having gone 12 months without a period. So that is the definition of menopause, when you have had no periods for a full year. So in perimenopause, ovarian hormone levels are declining, and in particular, progesterone levels are pretty steadily declining. So progesterone levels, oftentimes we can kind of track them. If we were to check your blood level year after year in your 40s, we would see that they just steadily decline. And then estrogen levels in perimenopause really fluctuate. So 1 month they might be high, one month they might be low. And then in menopause, hormone levels are just very low, so much lower than you had ever experienced before. Your ovaries are no longer making hormones; they're done. You're not cycling anymore, and estrogen and progesterone levels are just simply very low. Um, so, as we discussed in our prior webinar called Hormones 101, estrogen and progesterone are just two of many hormones that our body makes, that our endocrine glands make. And there are some hormones in addition to estrogen and progesterone that I'd like to point out made by other endocrine organs that play a role during this time. And some of these you may recognize. So, the adrenal hormones cortisol and DHEA. So cortisol you might recognize as the stress hormone. DHEA is a hormone that converts to estrogen and testosterone by the body. And then insulin, which is a pancreatic hormone that is involved in blood sugar control, and thyroid hormones. So, thyroid hormones interact with ovarian hormones quite a bit. They're made by the thyroid gland, which is at the base of the neck, and have a lot to do with metabolism, so driving your metabolism. And then this is not a hormone, but the gut microbiome. So we're going to circle back to the gut microbiome. We've talked about this quite a bit in previous webinars, but the gut microbiome also plays a big role in how you balance your hormones and how you make hormones, regulate hormones, recycle hormones, detoxify hormones. So the gut microbiome is a big player, and we'll talk more about that as we go through this. So I would like you to think, instead of my hormones are broken, we're done, there's nothing we can do here, to understand that your body is just going through a transition and that you might need more support now than you had in the past with hormones. So let's talk about why these symptoms that we associate with perimenopause and menopause happen. And as a naturopathic doctor, I don't just like to name the symptoms. I really like you to understand why they are occurring. And so, for instance, we mentioned progesterone declining in perimenopause. That decline will result oftentimes in increased anxiety, irritability, difficulty with sleep, and changes in your menstrual cycles. So periods might be closer together, or you might be skipping periods, or they might be irregular. Estrogen levels, as they're fluctuating up and down in perimenopause, that can lead to mood swings where you might be irritable one minute, crying the next. You might feel like your mood is all over the place. You might also notice breast tenderness or breast swelling, and you might notice that your periods are just heavier. So that can be as a result of estrogen fluctuations. And then, as I discussed in my last webinar, your adrenals are playing a much larger role than they have in the past for you. And there are two main reasons for that. So, DHEA is an adrenal hormone that is produced and broken down in your body into estrogen and testosterone. So, those two hormones are replacing your ovarian levels of estrogen and testosterone and helping you out with some of that hormone production. So if you have sufficient levels of DHEA, that can be a good thing for you as you go into perimenopause and menopause. But then also declining levels of ovarian hormones can result in high cortisol. So your adrenal glands often will produce more cortisol at this time in life. Cortisol is known as the stress hormone. It's something we produce in large quantities when we're under stress, but it also happens in menopause. So a lot of people don't realize this, but it can be an underlying cause for weight gain, especially in your midsection, fatigue, poor sleep, and worsening hot flashes and night sweats. So the adrenal health piece is a really big one. And then I briefly touched on insulin and blood sugar. So some of these symptoms are driven by problems with insulin and blood glucose. So when estrogen levels in particular are declining, your cells become less sensitive to insulin. And insulin is a hormone made by the pancreas that carries blood sugar into your tissues so you can use it as fuel. And so when your tissues are less sensitive to insulin because your estrogen is low, you can develop high blood sugar, which can lead to prediabetes and diabetes. It can cause weight gain in your midsection once again. It can make you feel tired, and it can also drive hot flashes and night sweats. So there's a big blood sugar insulin connection, and there's a lot we can do with lifestyle and diet to improve that, even if your estrogen levels are low. And then I wanted to talk about gut microbiome and detox pathways, liver detox pathways, and their role in this. So in terms of the gut microbiome, when your estrogen levels are declining, your ability to recycle estrogen decreases. And the reason for that is that low estrogen leads to less gut microbiome diversity. So, less diverse bacteria in the gut that normally are able to recycle estrogen and allow you to use it again. It's kind of a double whammy where your estrogen is low and you'd like to be able to recycle it because you don't have a lot of it, but yet you can't because you can't recycle it effectively because your gut microbiome diversity has declined. So this is something that we can address with diet. I'm not going to go into that in detail today, but just wanted to mention that as an area of importance. And then also liver detoxification. So the liver enzymes break down estrogen and all hormones. And if the liver isn't functioning optimally, if you've been exposed to environmental toxins, your ability to break down and process estrogen and other hormones is diminished, and you are likely to have increased menopausal and perimenopausal symptoms. So we want to make sure the liver is working as well as it can during this time. And then inflammation. So there is an inflammation piece in these hormonal changes. And what that is all about is that as estrogen, progesterone, and testosterone decline, you can develop kind of a chronic low grade inflammatory state because those hormones are naturally anti-inflammatory. So when you don't have a lot of them, you can become inflamed. And so a lot of women notice that they have more musculoskeletal aches and pains, just out of the blue for no reason, not associated with an injury or overuse. It just comes on out of the blue. And it is oftentimes related to low levels of hormones and that chronic inflammatory state. So some common symptoms, many of you have, heard of these or are familiar with them, but I just wanted to review them so that you can kind of put them into systems and maybe make some sense out of them. Um, are kind of in the realm of sleep and energy. Women oftentimes notice that they are having trouble falling asleep, they're having trouble staying asleep, and they're waking between 2 and 4 o'clock in the morning. And this results in fatigue. And you could be fatigued from low hormones just by itself, but certainly be fatigued because your sleep is interrupted. So this is a big one. It's a very common part of the perimenopause and menopause symptom package is the sleep disruption. And then mood and brain can be impacted. So we touched briefly on anxiety and irritability and low mood. So these can occur due to hormone changes. And then also, this is not talked about as much, but you might experience brain fog and cognitive changes and memory problems. So estrogen levels declining in particular can really impact the way that your brain works. And it can take some time for your brain to create new pathways and figure that out. Testosterone plays a role as well. Um, and then metabolic. So many women notice that they're gaining weight or they're just shifting weight around so that there's more weight in the midsection. You're kind of gaining weight where men gain weight all of a sudden, whereas you used to have a waistline and now you don't. Also, there can be a loss of bone density and there can be a loss of muscle mass at this time due to declining hormones. In the realm of sexual health, low libido can be something that crops up, and then also vaginal dryness due to low estrogen levels. And then stress tolerance. So you may have been, perfectly comfortable juggling a lot of challenging situations in your life and doing many things for many people, and then all of a sudden you might feel completely overwhelmed and like you can't handle as much and your stress tolerance becomes lower, and you have to say no to more things, and that is a common phenomenon with these hormonal changes as well, and that your ability to handle stress is less. So instead of seeing these, I know I've kind of broken them down into individual symptoms, but instead of seeing them as individual symptoms, I like to use them to create a picture of what might be going on with you and start connecting the dots. So let's say your main concerns are anxiety and sleep disturbance that have just come on for no apparent reason. That would tell me, for instance, that your progesterone level is likely low. So there are some patterns to these hormonal changes that we can oftentimes figure out. And then we can also do testing. So I order blood testing and then also a pretty sophisticated urine analysis of hormones to help me if I need help to figure out what's going on with the hormone balance. And then I wanted to talk about the hormone changes impact on relationships, since this is for couples or women and their partners. So this is the part that doesn't really get talked about very much is the impact on relationships, but it is very real. And there can be increased emotional reactivity when a woman is going through these changes. So the changes are impacting her mood and her nervous system, and it can result in increased reactivity. So that combined with maybe lower libido, less interest in intimacy or discomfort with intimacy, can really come together to be pretty challenging. And it is something that basically can create misunderstandings and a lot of hard feelings. So it's important to know physiologically what's going on and then what things we can do to help that. So if there's one thing that partners should know, it's that these changes are physiological and they're not personal. So it's easy to take it personally because your partner perhaps has all of a sudden started acting fairly erratically or differently, or they're maybe much more moody and they don't want to be intimate. And it's not about you, it's really about what is going on in their body and the transition they're going through. So, my suggestions to begin with would be to just try listening without trying to immediately solve the problem, but just be present and to listen to the concerns of your female partner. And then maybe to ask, what can I do to help right now? And maybe there isn't anything, maybe it's just to listen, but maybe there is something that is helpful. And then also helping to reduce her load of stress. So, stress is hugely impactful in a negative way during this time, and taking off responsibilities from your female partner's list of things to do is it's a big gift. So I highly recommend that whenever you can. So let's talk about more naturopathic approaches that we can use that actually help with these transitions. So I'd love to start with nutrition. Food and nutrition really is our one of our most basic underpinnings of health. So it's our foundation, and there's a lot we can do with it. And some of the key elements of nutrition that I wanted to bring in for this phase of life are, and I've talked a lot about this in some other webinars, so this might be a little bit different from what I've said previously, but prioritizing protein is actually quite helpful. So I mentioned that there is a loss of muscle mass that occurs during this time and a possible blood sugar control problem. And so protein can address both of those. I recommend incorporating 0.8 to 1.5 grams of protein per kilogram of body weight at this time to support both maintaining muscle mass, building muscle mass, and then also balancing blood sugar. So I actually recommend a combination of protein, healthy fats, which come from things like wild fish, nuts and seeds, olive oil, avocado, and then also dietary sources of fiber, like fruits and vegetables, whole grains, beans, nuts and seeds. Those are your macronutrients that are your most important types of foods to keep things regulated in perimenopause and menopause, especially with blood sugar. So we want to keep blood sugar as stable as possible. That can promote steady energy throughout the day, steady mood throughout the day, can help you to maintain your weight, can help you to maintain your muscle mass. Um, and so we can go into that in more detail privately, but those are the macronutrients, the main big elements of the diet that I recommend are protein, healthy fats, and sources of fiber. So I also like to recommend that you limit certain foods that can be destabilizing to the blood sugar. So these include sugar, sweetened foods and drinks, white flour products, and alcohol. So all of these foods worsen blood sugar control and make all of the menopausal symptoms worse in general. So I recommend limiting those.
I just want to jump
Yeah,
in and
go
just
ahead.
remind everybody that and this is such great information. I just want to remind everybody that you're welcome to either raise your hand or drop any questions in the chat as you're getting all this information. If something comes up for you, or if you have something to share, please speak up because, yeah, we want this to be a conversation.
Yes, this is a tiny group, so we can absolutely have a conversation. And I'm just giving you a barrage of information here, so feel free to interrupt me if you have any questions. Um, Movement is also incredibly important. So there are two key elements of movement that I recommend in this time of life. Um, Weight training, strength training, and walking or something similar to that that's more anaerobic. But the strength training can address multiple concerns, including maintaining bone density, maintaining muscle mass or building muscle mass, maintaining blood sugar control, maintaining your weight. And then walking is a great stress reduction factor. So something anaerobic that's relatively calm, more low key, where you're not in an aerobic state, is actually beneficial. And I recommend not overtraining during this time. So that is perceived by the body as a stressor. And it can actually reduce your adrenal glands' ability to make some of their hormones that actually help you during this time. So weight training and something like walking are fantastic, but you don't need to go above and beyond and overdo because that could actually be detrimental in this time. Um, then I recommend looking at your stress levels and your nervous system health. So we talked about this a little bit already. Stress can really negatively impact your situation in this time. It can make all of your symptoms worse. Obviously, we all experience stress and some things we just can't control. But within your control, I recommend saying no to some things that maybe you would have said yes to previously because you felt like you had to or you felt obligated to. Maybe take some more time for yourself during this time in life. Try not to get overwhelmed with too many responsibilities if you possibly can. Really prioritize your sleep, set up a good bedtime routine, carve out that time to get ready for sleep and so that you can get a good 8 hours of sleep or more during this time. Make sure you have time in nature on a regular basis. Some people like to meditate or do yoga or visit with a therapist. There are a lot of different ways that we can reduce stress and manage stress. So that is a key component and probably more important at this time in life than maybe it was previously for you. And then there are some targeted naturopathic therapies that I will use. So these include vitamins, minerals, amino acids, fatty acids, and then herbal formulas or single herbs that I use to support adrenal function. As we mentioned, adrenal function, very important during this time. And then also just to address low levels of hormones. So specific herbs can be used to address low estrogen, low progesterone, and low testosterone. And so this is all very personalized. There's no one, set of things that I use for every patient. It's very much based upon what is going on with you and what you need. So come see me if you'd like some naturopathic support that's very personalized and targeted towards exactly what you need. Or we can talk about hormones. So some women really benefit from hormones and they are appropriate for some women. So hormone replacement is an option. And this is also a personalized approach where myself or your provider will consider your family history, your own health history, your current symptoms, and determine if it's a good fit and then what hormones might be most appropriate for you. But that can be a big help and it can be appropriate for a lot of women. And then I wanted to talk more about how partners can help bringing that piece back in. So I do recommend learning what's going on with your female partner biologically, and we're doing that today. And there are other resources as well to really understand exactly what's going on here, and to be patient with those changes that are occurring, and it um, can be upsetting at times that this person that you've lived with maybe for many years is changing and it is a transition, but try to be patient with it. And also to be supportive with maybe some lifestyle changes that they are making to improve their health. So oftentimes this is a time when you're reassessing your health and thinking about, okay, what is really important for me right now to maintain and even improve my health over the next 3 decades, let's say, the rest of my life. This can be um, a real time when you're just reassessing your entire life in your future. And so you might be incorporating new dietary strategies. You might be incorporating a different exercise routine or exercising for the first time ever. Or you might have some new hobbies or new interests that you want to pursue. And sometimes this can be unsettling for the person who's living with that woman. Like all of a sudden, maybe they don't want to have sit and watch a TV show and have that glass of wine with you after dinner as a way to relax. Maybe they want to go out and go for a walk. And just being supportive of that and not belittling or discouraging, new healthy behaviors is helpful. And just being encouraging and open is great. And this is not an ending. It's really a new beginning and it's just a new phase of life and it can be exciting. So I recommend just being open to those changes. And then to maintain the emotional connection in the relationship. So sometimes when one person is changing, it can be upsetting, confusing for the other person, and you can grow apart. And it's important to check in regularly. I recommend like a weekly relationship check in where you can talk about your emotions, how you're feeling, and just trying to be open to what the other person is saying and be receptive and supportive and helpful can keep the two of you connected in an open way. So, yeah, so I just wanted to finish by saying that menopause is not a disease, it's a transition. It really is an opportunity to reassess your health and to create some new habits, new strategies. Think about your life, the remainder of your life in a new way, and maybe to set some stronger boundaries or clearer priorities for that next phase of life. Um, so yeah, that's what I wanted to say about this time in life. And if you are already doing all the basics, so you're taking good care of yourself, you're eating well, you're exercising, you're managing your stress, but yet you still feel like you're struggling with perimenopausal and menopausal symptoms, come see me. I have a lot of strategies to help.
Cool. Thank you
So,
so much. I had a question. What what are some gifts that come with especially like menopause once the transition is over? Um, I've heard
Yes.
people say that it's almost like they're developing new superpowers, and I'm just curious, what does that mean exactly? And yeah, if you have
Yeah.
any thoughts about that, some of the gifts that can come on the other side once the hormones have kind of like figured out their new normal.
Absolutely. Yeah, I can speak from personal experience and then also working with patients over the last couple of decades. But number one, you don't need to worry about getting pregnant anymore, obviously. So you're you're not needing to be on birth control or be concerned about that. So that is a freedom. And if you can maintain or reignite your intimacy with your partner, then that can be very freeing. And you can have kind of a new experience in that realm that a lot of people really are surprised that like a whole new sex life after menopause, because there are certain things that you don't need to worry about anymore, which is nice. And then also there with the change in hormones, there is oftentimes a decrease in concern for managing others. So your likelihood of feeling like you need to kind of micromanage your children or your spouse oftentimes slips away, and your likelihood of wanting to overgive and overplease oftentimes goes away as well. And you can be more focused on what is important to you, what are your priorities, rather than like over giving and over pleasing. So that can result in you finally having the time to pursue your own interests. And so those are the things that I've seen and that I've heard from patients as well. But there are very likely other things as well. So that's a good question.
Awesome. Thank you.
Yeah.
Are there any other questions for Dr. Abigail? Before, and I'd love to lead a guided relaxation if you're open to it.
Sounds wonderful.
Okay. Any other questions for Dr. Abigail before we transition to um, guided relaxation?
I don't have a question. I do appreciate the explanation of sort of the holistic and far-reaching effects. I didn't understand how many different bodily systems were in play with that. So that's really an eye-opener for me.
Glad to hear it.
Yes. Yeah, it touches everything. It seems like every
It
part of
does. It does. Yeah, so not everyone is going to experience all of those things that I mentioned. And you might, if you have any struggles at all, you might experience them in one particular area, or you might experience many of them. So it really is quite variable. Some women really sail through this pretty smoothly without too many difficulties. And then other women feel like, oh, yeah, I can check off every one of those boxes because I'm experiencing all of those. So it's highly variable. In my own experience and with treating patients for hormone imbalance for 21 years now, I would say that stress does play a big role. So if that's one thing that you can promise yourself you're going to make some changes in, especially if you're in perimenopause or slightly before perimenopause, I highly recommend like really taking good care of yourself and managing stress to the best of your ability. Because your ability to sail through this phase smoothly really can depend upon your adrenal health and your stress levels, just prior to and during this transition. So not everyone obviously can control everything, but that seems to be a really big piece.
Yeah, that's actually a really good segue because one
Mhm.
of the ways you can control stress or support yourself in managing stress is taking time for guided relaxation or meditation. So I'll guide us in a progressive relaxation where we'll connect with a sense of our own resilience to to navigate the changes in life. Um, because there are always changes, and these are just some big ones, perimenopause and menopause.
Yeah.
So I invite you, and thank you so much for that teaching and for sharing all of that. And that's such good information and helps us to understand
You're
the dynamic.
welcome.
So I invite you to just feel your seat, or you're always welcome to lie down as well. So getting in a comfortable position, whatever that is for you, and allowing your eyes to gently start to soften and maybe even close. And just noticing your breath going in and out without changing it in any way, just connecting with your breath. And this is a really good stress release strategy in itself, is just noticing your breath and maybe allowing it naturally to slow down a little bit as you allow your body to relax. And then every time you inhale, imagining yourself inhaling clarity and exhaling any stress or tension, just allowing it to fall away from you with every exhale. Inhaling clarity and peace, exhaling any stress or tension, and just allowing yourself to start to relax here and get comfortable, allowing the needs of the world or anybody else to just wait for a while. This is your time for you. And as you allow yourself to get more comfortable and more relaxed, let's imagine a wave of relaxation moving from your feet up through your legs, relaxing every part that it touches, feeling your toes, your heels, the soles of your feet, your ankles. Get really relaxed and heavy, allowing that wave to come up through your ankles, your calves and shins, your knees, your upper legs, your hips, your lower abdomen and lower back. Feeling your legs, feeling really heavy and relaxed as the wave continues to move up through your heart and upper back, up through your shoulders. And from your shoulders, the wave goes down into your arms, allowing your entire arms to completely relax. Upper arms, elbows, forearms, wrists, and hands, feeling heavy and relaxed. As you feel the wave going up through your neck, letting go of any stress or tension held in your neck. And if you'd like, you can even just very gently move your head from side to side, just allowing anything that's holding in your neck and shoulders to just move away from you right now. As your body gets more and more relaxed and comfortable, and feeling the wave moving up through your chin, relaxing your mouth, the muscles around your mouth, your cheeks, nose, eyes, forehead, and the back of your scalp. Your entire head is feeling relaxed and comfortable as you allow any thoughts to fall away. Any unnecessary thoughts can just drift away from you right now. You don't need them in this moment. And just allow yourself to feel more and more relaxed and comfortable, going deeper and deeper into relaxation with every breath. And from here, we're going to engage your imagination. You're going to see yourself climbing up a path, which is a mountain path, a beautiful mountain path. You might notice wildflowers around you, greenery, beautiful blue skies, a gentle breeze, and the temperature is just perfect. Just notice the breeze touching your hands, your face, as you feel your feet on the ground and stepping up this mountain path. And with every step, you get even more relaxed, even more comfortable in your body. And as you move up this path, the vegetation might change. It turns from wildflowers to more shrubs and trees. And you keep walking up this path. And then the trees and shrubs start to shift and it becomes a little more bare with a lot of rocks around you. And you just keep putting one foot in front of the other, just walking up the path, continuing to feel really good in your body, really comfortable, and at the same time strong, capable, capable of climbing this path. And maybe some parts feel a little bit challenging. Maybe some parts are a little bit steeper, but you know you've got this. You can handle this. You're strong, capable, resilient. You keep walking up this path, noticing just the cool rock formations around you. And at some point, you barely even notice this, but you find yourself at this vista where you can stand up at a place and really look around at the views from this mountain. You can see other hills and valleys around you. Maybe you see a small town or village. You might see a few more mountains in the distance. And just noticing how beautiful everything is and how strong and capable you feel in this moment. And as you look out on this beautiful view, you notice any sounds that might be around you. There might be birds chirping or crickets. Or maybe it's just the sound of the light breeze that comes up every once in a while. You notice the colors of the view around you, the color of the sky, any plants that might be nearby. You allow yourself to just take it in with your eyes. And then noticing any sensations as well. Maybe you feel the warmth on your skin, the sun gently caressing your cheeks, the breeze tickling your fingers every once in a while. And as you stand here looking out on this vista, here in the comfort of your own mind, of your own imagination, allowing yourself to reflect on how similar this mountain path is to your own life and maybe the life of your loved ones, the ones close to you, where the scenery changes. It can look very different from part to part, and some parts can feel pretty challenging. Some parts are pretty steep, and then there's downhills where you coast and it feels easy, and you can even sing and skip. And just reflecting on how life is like that. Some parts can feel more challenging, like there are things to figure out. There might be hormones that are changing, and you might need to go get some extra support as you navigate. But through it all, you have a sense of your own strength, your own resilience, and your ability to navigate all of it. The tough parts, the easy parts. You can find joy in every part of the journey. The tough parts that are steep and maybe even have you cursing a little bit under your breath, those parts actually make you stronger. And when you're done with them, you feel so proud of having gone through them. And those parts are critical in getting you to the beautiful vistas, to those moments where you can really look around and enjoy the views. And then, of course, the easier parts where you go downhill and life is just a breeze and feels easy. And those parts are wonderful too. They may not get you up the mountain, but they're wonderful breaks in between some of the steeper parts. And just noticing how strong you feel in this moment in your own body. You've made it up this mountain path. You get to enjoy the views. You are strong and capable. And taking a few moments to reflect on some affirmations here. I'll share some with you, and you might come up with some from your own consciousness. And just playing with these in your mind. I am resilient and capable. I can navigate whatever life brings my way with joy and ease. It's okay to reach out for support when I need it. Reaching out for support is actually a strength, not a weakness. I am learning and growing every day, even as I enter new phases in my life or my partner's life. I'm capable of finding joy in the changes of life. I'm capable of taking good care of myself, no matter what, and supporting my loved ones really well. I am figuring it out. I'm doing my best. Taking a few moments to allow any other positive, powerful thoughts to bubble up from your own mind, your own consciousness, anything that can support you as you continue to walk up the mountain path of your own life with all of the changing scenery. In a moment, I'll be counting you back from 5 to 1. But before I do that, take a moment to just reflect about this space that you've visited within your own mind. And remember that it's a place you can visit anytime you'd like, anytime you need to remind yourself of your own strength, your own ability to navigate the changes of life, your own ability to get up the steep parts, even if they feel freaking hard in the moment. You can do it. You've done hard things before, and you can absolutely handle any hard things that might present themselves as you go. 5, feeling a sense of your own strength and capability that you take back with you from this experience. 4, connecting with your breath once again, noticing your breath going in and out. 3, noticing your connection with your seat. 2, feeling present, energetic, and vibrant, knowing you can handle anything that your life brings to you. And 1, allowing your eyes to gently start to open, moving around in any way that would feel good to you. If you need to do some stretches here, some shoulder rolls. Welcome back.
Thank you. That was beautiful.
Mm.
Looks like it's getting dark.